Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Glaucoma is a group of eye diseases that damage the optic nerve, which sends visual information from the eye to the brain. Glaucoma occurs when fluid builds up inside the eye, putting pressure on the optic nerve. This can be caused by blockage of the drainage system in the eye, increased production of fluid, and damage to the drainage system. Glaucoma is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to glaucoma and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Glaucoma often has no symptoms in its early stages. As the condition progresses, symptoms may include gradual loss of peripheral vision, blurred vision, halos around lights, pain in the eye, and redness in the eye. Multiple terpenes found in cannabis, including alpha-pinene, beta-caryophyllene, limonene, and myrcene, are thought to help manage glaucoma due to their anti-inflammatory, antioxidant, and potential neuroprotective properties. However, this is largely based on observations of overall cannabis effects, and no specific terpene has been proven to directly lower intraocular pressure, the key risk factor for glaucoma. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Key terpenes potentially beneficial for glaucoma. Limonene has powerful antioxidant and anti-inflammatory properties. It may also aid in reducing anxiety, which can be a comorbid condition with glaucoma. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene can help reduce inflammation, anxiety, and depression. Research suggests it may also have analgesic effects. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. Studies show it has anti-inflammatory and tranquilizing effects. It has demonstrated neuroprotective properties in preclinical research. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene provides a sedating and relaxing effect, which can be useful for reducing pain and inflammation. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Alpha-pinene, known for its anti-inflammatory effects. In preclinical studies, it has demonstrated neuroprotective properties by protecting against oxidative stress and neuronal damage. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Lemon Sour Diesel. THC is the primary compound for IOP reduction. Research has shown that tetrahydrocannabinol, THC, is the primary cannabis compound that effectively lowers IOP. The effect, however, is temporary, lasting only 3 to 4 hours, and medical authorities do not support its use due to this short duration and potential side effects. CBD's effect on glaucoma is debated. Some early studies suggested that cannabidiol, CBD, may actually increase IOP in some individuals, but more research is needed. Current evidence suggests it is not a reliable treatment for managing eye pressure. Professional medical guidance is essential. Glaucoma is a serious condition that can lead to irreversible blindness. It is crucial to continue using prescribed medications and follow the treatment plan recommended by a qualified ophthalmologist. No terpene or cannabis product should ever be used as a replacement for conventional, scientifically validated treatments. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.